While Senate Republicans were pushing for repeal and replace this week, a bipartisan committee of senators was actually looking at ways to shore up the Affordable Care Act. I'm Brynne McBride of ABC for Health, and we're talking about hearings that happened in front of the Senate Health, Education, Labor, and Pensions Committee. And this is an acronym that spells out HELP, and they were trying to help the Affordable Care Act. There have been polarizing discussions lately about repealing and replacing the Affordable Care Act, but some senators invited governors and health policy experts and hospitals and insurance commissioners to come and give their ideas of ways that small tweaks could be made to the existing law to help stabilize markets and to help bring down premiums. Now, they heard a lot of testimony, and they came away with a couple quick fixes that a lot of the parties testifying could agree on. Fund subsidies for low-income enrollees, shore up money for things like cost-saving reductions, and create flexibility for states. That is a bipartisan issue, but do it in the form of some creative innovation waivers. These are the Section 1332 waivers, not the demonstration waivers 1115 that governors are trying to use to chip away at some of their Medicaid programs. These recommendations came out of the committee in addition to things like creating a reinsurance or shoring up the reinsurance that was in the Affordable Care Act to bring down premiums and bring down costs to all consumers, increase money for marketing, outreach, and in-person support, something that we saw take a dramatic hit when the administration cut money from both navigators and 90% of the outreach and education and marketing budget. And then again, people one after another kept saying, and give money to the states to try to do the Affordable Care Act in a creative way, to create new systems of enrollment, to create new delivery systems, to create new enrollment systems, all things that would help get a little momentum going and help create some fixes to some of those little tweaks to the Affordable Care Act that needed to be happening all along. These were powerful testimonies that we saw faces that we hadn't seen in a while, some insurance commissioners that hadn't been to Washington in a while, and some health policy experts, part of old administrations, part of the Obama administration that came back to show some of the best practices, some of the fixes that could have been made if Congress had been working in a bipartisan manner this whole time, some simple fixes to the Affordable Care Act that could have all of this while been building more stability into the marketplace, and instead, because of the contentious political environment, were left to the wayside. This committee was an attempt to bring back a bipartisan conversation of the way to make the law as it is right now work for more people in the United States. You can read some of those hearings and that testimony yourself. If you click on that information button you see on your screen, the Help Committee's website, the Senate Help Committee, has testimony from everybody that came before them, and they share that publicly on their website. You can also read a couple articles of interest that summarize some of the key moments of testimony and some of those joint ideas that came out of there for fixing some of the small glitches in the Affordable Care Act. The consensus coming out of these committees was not to scrap the whole thing and try something brand new, but instead start working towards building those fixes that is then going to impact the most number of people. You can share your Affordable Care Act or send us an email by clicking on that information button. If you're watching us on YouTube, you can also like or subscribe to our channel. Thanks for joining us.